Okay, now we're on.
Okay. So basically we just do a run through of the presentation and then make sure we watch our time. So it's like 15 to 18 minutes. So
Okay.
that's the first thing.
I just had one suggestion on the PowerPoint. I would suggest that we switch slides 5 and 6 so that the symptoms come before the diagnosis. I think it just makes it flow a little bit better.
I have, on the PowerPoint that I have the symptoms on slide 4.
That's what mine is too.
Okay, because my slide 4 is causes.
Oh.
That's my 5.
My symptoms too.
Uh-oh.
Okay.
Or did we do some of the same, like, are we going to be depending on some of the same things?
Well, it sounds like there's 2 different versions of the PowerPoint out there. Has everybody taken the last version sent out by the email? I guess that's the last one, right?
Yeah, I sent out in an email, I think.
Yeah.
I just downloaded the last one that you sent through our student email.
Yeah, on the 5th.
Yes, I'm looking at the one on my Gmail account.
It should,
So that would be the Google Docs one, which I think there's been some changes since that one.
Mm-hmm.
do you have one on your, like, Mercy email?
I'm looking.
I think I sent the PowerPoint and the paper together.
Mm-hmm.
Yeah, that's the one that I opened.
I think that's the most up-to-date one, isn't it?
Yeah, it should be.
Okay.
I have the symptoms on slide 4 though.
Yeah, that's what I have.
And then the diagnosis on slide 6.
Okay, so so the way that I have it in here, I have slide 4 is causes, slide 5 is symptoms, and slide 6 is diagnosis.
Okay, so your 4 and 5 are opposite of.
Oh, okay. So I remember I switched 2 of them because I was playing around with it a little bit. So maybe it was 4 and 5 that I switched. Okay. How does everybody like that?
So
Okay, what was your suggestion?
So on the PowerPoint it goes causes, symptoms, and then diagnosis.
okay, that makes sense. So we should switch our slide 5 and 4 around.
Okay.
Oh, I see what you're saying.
Yeah. I was kind of going through it earlier and it just seemed like it flowed a little bit better that way.
Okay.
So you have 4 causes, 5 symptoms, and 6 diagnosis.
Mm-hmm. Yep.
Okay.
Does
Well,
that mess up your presenting at all?
I don't think so.
It messes. Well, I have a note card about like the what is a heart attack, the statistics, and then the symptoms.
Okay.
So I don't know how we want to go about that.
I mean, when we get to that point, I can jump in there and do the causes, and if you want to come back and do the symptoms, and then I can go into the diagnosis.
Okay, so just go back and forth a little bit?
Yeah.
Okay.
If you're fine with that.
Yeah, that's fine with me.
Okay.
Just as long as, like, we each try to shoot for, like, around 4 minutes, maybe a little less. That would, like, make things even, but if someone does a little more, like, that would be fine too. Okay. So does that that doesn't mess up anyone else's, does it?
Nope.
Okay. Haley, did you find the one in your student email?
Yeah, finally I did.
Okay.
So then I have a question on the risk factors one. It says high blood sugar, overweight and obesity, and then diabetes.
Oh yeah, we can.
Technically, diabetes and hyperglycemia are not the same thing, though.
Mm-mm.
Okay.
So diabetes would be more chronic, and high blood sugar would just be acute.
They can both be chronic, but diabetes usually indicates that there's some sort of insulin issue.
Right.
Where you can always just have high blood sugar because maybe you just, I don't know, maybe you just go around and you eat candy all day long or something like that.
Yeah, that's true.
You know, so.
Oh, and then I was going to say about adding family history of heart attacks to risk factors also.
Yeah, you could add that. That would be fine.
Okay. Oops.
You can talk about it in the thing, and then we can like add it to the PowerPoint before we send that in.
Okay.
I was also thinking that we should add some other medications to the list as well.
That's fine.
When I went through the medications, I kind of did each category, and then I listed out the medications that are a part of those categories.
Sure. Like, well, because like not every heart attack victim is going to receive all these medications, but they are all probably going to receive like aspirin and nitroglycerin and morphine.
Right. Yeah, I don't have anything about nitroglycerin.
Should the title of the PowerPoint be changed to myocardial infarction?
Yeah, I think so.
Okay. Do you think, are we ready for the practice run through?
Yeah, I'm ready.
Okay. I have a stopwatch going so we can see where we end up. Should we start out by introducing ourselves, I guess?
Sure.
Okay. Well, I'm Tess.
I'm Justin.
I'm Laura.
I'm Haley.
Okay, and we will be discussing myocardial infarctions, which is more commonly known as a heart attack. And to break up the word myocardial infarction, myo means muscle and cardia means heart, and infarction means the death of a tissue due to the lack of blood supply. And the heart requires a constant supply of blood, and when those arteries of the heart become narrow, the blood cannot flow as it should. And this can cause a buildup of fat, cholesterol, or other substances forming plaque, which can damage or destroy part of the heart, which can lead to a heart attack. So I have a picture of a heart, and this is your coronary artery, and this circle right here is, oops, sorry, can't see it, is blown up right here, and you can see that like plaque and other substances are forming in the artery, so the oxygen can't get to the heart, and so this darkened area of the heart is the damaged tissue caused by the lack of oxygen, which can ultimately lead to a heart attack. And coronary artery disease also happens when the arteries that supply the blood become hardened and narrowed, and ultimately that can lead to chest pain or heart attack as well. And coronary artery disease is the most common type of heart disease and also the leading cause of death in the United States for both men and women. And over time, coronary artery disease can weaken the heart muscle, which can contribute to heart failure and arrhythmias. And heart failure means that the heart can't pump the blood to the rest of the body, and an arrhythmia is an abnormal heartbeat. So some of the statistics about heart attacks is that in the United States, someone has a heart attack every 34 seconds, and every 60 seconds, someone in the United States dies from a heart-related disease. About 720,000 people in the United States suffer heart attacks each year, and of those, 515,000 are first heart attacks, and 205,000 have previously had a heart attack in their past.
All right. Some of the causes, there's two main causes of myocardial infarction. One is where one of the main arteries that supplies the heart becomes blocked, either because of too much buildup or some of the plaque that we discussed earlier breaks off and then lodges itself in the artery and stops it. The other cause is when one of the arteries itself constricts or clamps down to the point where all blood flow is constricted, and that can also cause a heart attack.
Some of the common signs and symptoms of a heart attack can include pressure, tightness, pain, or aching in the chest or arms, and this can also spread to the neck, jaw, or back area. And then other symptoms might include nausea, indigestion, or heartburn pain, shortness of breath, sweating, fatigue, weakness, and a rapid or irregular heartbeat. And it's important to recognize these signs and symptoms and take them seriously because every minute counts when it comes to treating a heart attack.
Diagnosis of a myocardial infarction sits on the symptoms and some test results. Some of the first tests to be done are going to be an EKG, which is an electrical tracing of the heart activity. This can show where in the heart the infarction is happening. Some blood tests can be done as well to test for some enzymes like troponin. These enzymes are elevated in the event of a heart attack and can indicate how long the heart attack has been going on and potentially the severity. Cardiac catheterization can also be done, which will involve a surgical procedure to directly look at the vessels of the heart from the inside. The first thing to do if you suspect you or somebody you know is having a heart attack is to call 911 and seek help. Every minute that goes by, more heart muscle dies, so it's important that help is on the way. Also, you need to understand, the process that goes into it. It's typically better to call for an ambulance than to just get in the car and try to drive to the hospital. The first line of treatment can be done in the ambulance on the way to the hospital. It's a good idea to know all your medications, your allergies, and who your healthcare provider is. Knowing your medical history is also important, especially if you've had any other heart events. And as I said earlier, it's good to get treatment right away.
Okay, now we'll move on to treatment. So there's a variety of different drugs used to treat heart attacks. Most commonly used is aspirin. And aspirin thins the blood to prevent blood clots from forming. So if you have a blood clot, it's going to block the vessel that feeds the heart, and that's what causes the heart attack. So many at-risk patients are prescribed 1 baby aspirin each day as prophylactic treatment for heart attacks. Another commonly used treatment is antiplatelet therapy. This includes Brilinta, Effient, and Plavix. So platelets come to the areas of the body that are wounded, but if you have injury to the blood vessels, the platelets may cause blood clots. So you need to watch out for excessive bleeding or bruising while you're on antiplatelet therapy. And it's important to educate the patients and let them know of these side effects. And patients should also be aware that while taking antiplatelet therapy, they need to alert their doctors before any surgery or emergency treatment. Another drug therapy is thrombolytics, and this is most commonly heparin. So heparin drip is used for emergency treatment of heart attacks, and this will ideally be started within the first 30 minutes after seeking medical treatment. And thrombolytics are used to dissolve the major blood clots and stop heart attacks that would otherwise be deadly. So these drugs restore blood flow to the heart, sometimes only partially, so there will most likely be a need for follow-up therapy. And that includes cardiac catheterization. Another emergency treatment is nitroglycerin. And nitro is a vasodilator, which means that it's going to open up the blood vessels and lead to improved blood flow. So this treats angina symptoms like chest pain and pressure that occur. And chest pain and pressure occur when there's not enough blood flow to the heart. So nitroglycerin can be quick or long-acting, and it comes in a pill, tablet, skin ointment, or a patch. Another form of treatment, as mentioned before, is cardiac catheterization. And if you're sent to the cath lab, surgeons will typically perform an angioplasty. And this is when they insert a catheter into the artery of your wrist or your groin. And that catheter is going to travel through that artery all the way to your heart. And it will take 2D images to determine where the blockage is in your heart. And then a balloon will be inserted and inflated at the site of the clogged artery. And the balloon's going to push the plaque against the artery wall and then be removed. Sometimes it could be necessary for a stent to be placed where that balloon was. And a stent is a small metal piece of mesh which is permanently inserted to hold the artery open at the site of that blockage if there's too much damage. Another treatment when there is too much damage to the artery wall is bypass surgery. And some patients will have their surgeon harvest a vessel from another part of the body to repair the damaged artery in the heart during bypass surgery. And some more drug treatment for following a heart attack are beta blockers such as atenolol, bisoprolol, metoprolol, or propranolol. And these might be described after or during a heart attack to reduce the heart rate, reduce the blood pressure, and the cardiac output. So if all of these are reduced, the heart doesn't have to work as hard, so it requires less oxygen. But some side effects of beta blockers are dizziness, fatigue, and difficulty sleeping. Another treatment is ACE inhibitors such as quinapril, captopril, benazepril, and lisinopril. And ACE inhibitors are going to relax the blood vessels and lower the blood pressure, which improves the blood flow. And this allows the heart to pump more blood without added stress and workload. And the side effects of ACE inhibitors are dry cough and headache. Or patients may be prescribed statins. And statin therapy, such as simvastatin or atorvastatin, can reduce the risk of heart attacks by controlling LDL or bad cholesterol. And another good thing about statins are they improve the lining of the vessels and prevent platelet aggregation and reduce inflammation, and that's going to prevent blood clots as well. So a few side effects of statins are headache, difficulty sleeping, muscle aches, and drowsiness or dizziness. So another important follow-up for a heart attack is cardiac rehabilitation. And that's important because the patients need to be educated on why the heart attack happened and what lifestyle changes they need to make to prevent another heart attack from recurring. So this is going to take a whole team of doctors, nurses, exercise specialists, physical and occupational therapists, and dietitians, and possibly psychologists. So this whole team is going to communicate together to provide the best possible care for the patient, hopefully leading to a positive health outcome for that patient.
So some risk factors include smoking and long-term exposure to secondhand smoke, which increase the risk of a heart attack. High blood pressure, which can damage the arteries that feed your heart. High blood cholesterol. Diabetes. Obesity is associated with high blood cholesterol levels, high triglycerin levels, high blood pressure, and diabetes. An unhealthy diet. Lack of physical activity. An inactive lifestyle contributes to high blood cholesterol levels and obesity. People who get regular aerobic exercise have better cardiovascular fitness, which decreases their overall risk of heart attack. Age, men age 45 and older, and when men 55 or older are more likely to have a heart attack than younger men or women. Stress and a family history of heart attack. If your siblings, parents, or grandparents have had early heart attacks by age 55 for males or 65 for females, you may be at an increased risk. And then we have lifestyle changes, which would be stopping smoking completely, controlling your cholesterol, keeping diabetes under control, controlling your blood pressure, exercising, and maintaining a healthy weight. And then managing stress, either by trying to reduce as much stress as possible or practicing techniques for managing stress, such as muscle relaxation and deep breathing. And then we have the reference slide, which was the last one that I was given.
Okay. That was 15 minutes and 15 seconds. So we made our time.
I felt like I was talking too much.
Okay.
You think I had too much information in there?
No, because if you didn't, we wouldn't make our time.
Okay, so just leave it. Is that okay with you guys?
Mm-hmm.
It's fine with
Yeah,
me.
that's fine.
If you want to like give someone else like one of your slides or something.
Okay.
What do you think?
I mean, I kind of have all the drug stuff down, but does anyone want to do the cardiac rehabilitation slide? Or if not, that's okay
I don't
too.
care. I can do it. I don't.
Doesn't matter.
I love it too.
Yeah, that would work, I guess, if you don't care, Haley. Otherwise, I can do it if you don't want to.
No, I don't care. That's fine.
Okay. Okay. So let's do that then, and then.
Laura, did you have a bunch of extra information about it?
I just wrote like a little paragraph here. Do you want me to email it to you quick?
Yeah, that's fine.
Okay. Let me see.
Does anyone else have like any suggestions or anything while she's doing that?
Yeah.
I think it sounded good.
Okay. Perfect.
I'm just gonna send it through our group email that we already have.
Okay.
Okay, there you go.
Is everyone ready?
Yep.
Yep, I think so.
Okay. Should we start by introducing ourselves again, like we did last time?
Sure.
Okay. I'm Tess,
I'm Justin.
I'm Laura.
I'm Haley.
and we will be discussing myocardial infarctions, which is more commonly known as a heart attack. And just to break up the word myocardial infarction, the word myo means muscle and cardia means heart. Infarction means death of tissue due to lack of blood supply. The heart requires a constant supply of blood, and when the arteries of the heart become narrow, the blood cannot flow as it should. And this can cause a buildup of fat, cholesterol, or other substances, forming plaque. And this can ultimately damage or destroy part of the heart, which can lead to a heart attack. Coronary artery disease also happens when arteries that supply the blood become hardened and narrowed. And this can also lead to chest pain or a heart attack. And coronary artery disease is the most common type of heart disease and the leading cause of death in the United States for both men and women. So this is a picture of the heart, and here is your coronary artery. And this circle right here is blown up right here, and you can see that plaque and other substances are forming in the artery, which causes a blockage and a blood clot to form, and therefore the oxygen cannot flow to the heart. So this darkened area of the heart is the damaged tissue, and this is what can lead to a heart attack. So over time, coronary artery disease can weaken, and the heart muscle can contribute to heart failure and arrhythmias. And heart failure is when the heart can't pump blood to the rest of the body, and an arrhythmia is an abnormal heartbeat. And just some statistics about heart attacks is that in the United States, someone has a heart attack every 34 seconds, and every 60 seconds, someone in the United States dies from a heart-related disease. About 720,000 people in the United States suffer from heart attacks each year, and of those, 515,000 are first heart attacks, and 205,000 have previously had a heart attack in the past.
So all heart attacks are caused by a condition known as ischemia, which is a lack of oxygen due to a lack of blood flow. This ischemia can be caused by a blockage in an artery, say a piece of plaque that has come off of a different area of the body, a buildup of platelets or something like that, or if the coronary artery constricts or clamps down to the point where blood flow cannot pass it. The ischemia will cause heart muscle death, and that is when the myocardial infarction starts. As I was saying, this plaque can be from anywhere in the body, or it can be from the heart itself.
Common heart attack signs and symptoms can include pressure, tightness, pain or aching in the chest and arms, and this pain can also spread to the neck, jaw, or back area. Other symptoms can include nausea, indigestion, or heartburn pain, shortness of breath, sweating, fatigue, weakness, and rapid or irregular heartbeats. And it's very important to recognize these signs and symptoms and to take them seriously, because every minute counts when it comes to treating a heart attack.
So diagnosis of a heart attack can occur outside of the hospital. If you call for an ambulance, the ambulance can diagnose the heart attack right away. This is very important as time is heart muscle, meaning that as time goes by, more heart muscle dies. So some of the first things that professionals will do to diagnose a heart attack is use an electrocardiogram, which will do electrical tracing of the electrical activity in the heart. This will show where the heart attack is occurring, and then the treatment process can begin from there. In the hospital, they can do a couple other things. They can start to do blood tests. This will measure a lot of cardiac enzymes, as well as look for signs that cells have started to break down in the heart. Typically, the first test done is going to be a test for troponin. This will show stressed muscle and muscle that has died and has started to break down. Other things that can be done is x-rays can be used and dyes can be injected into the body to look at the coronary arteries to see if the blockage can be found that way. Cardiac catheterization can also happen, which involves a surgical procedure to insert wires and cameras and the like into the coronary arteries to actually look at the blockage itself. And then, as I was saying, it's important to act as quickly as possible if you think you or somebody else is having a heart attack. What's recommended is that 911 is called because treatment can begin much sooner that way. And it's also important to have a plan in place, especially if you believe you are in a high-risk category for heart attacks. This would include having a list of the medications you take, your allergies, who your healthcare providers are, any history of heart attacks that you have, and any other relevant medical history. It is typically best to seek care within the first 1 to 2 hours, just because in that time, a significant amount of heart muscle can be saved depending on the type of heart attack you're having. And yeah.
So next we will move on to the treatment. And we have drug therapy. Most commonly used is aspirin. And aspirin thins the blood to prevent blood clots from forming. So if you have a blood clot, it's going to block the vessel that feeds the heart, which is going to cause a heart attack. So many at-risk patients are prescribed 1 baby aspirin per day as prophylactic treatment for heart attacks. Another commonly used treatment is antiplatelet therapy. And platelets come to the areas of the body that are wounded, but if there's an injury to the blood vessel, the platelets may gather there and cause a blood clot. So patients who are on antiplatelet therapy need to watch out for excessive bleeding or bruising while taking this drug. And patients should also be educated by their healthcare providers that they need to alert doctors of antiplatelet therapy before any surgeries or any other emergency treatments that they may have. Another drug therapy is thrombolytics, and this is most commonly a heparin drip. And this is used for the emergency treatment of heart attacks. Ideally, this will be started within the first 30 minutes after seeking medical treatment. So thrombolytics are used to dissolve major clots and stop heart attacks that would otherwise be deadly. And the drugs usually restore partial blood flow to the heart, so most likely there will be a need for follow-up therapy of cardiac catheterization. And another commonly used drug is nitroglycerin. And nitro is a vasodilator, which means that it will open up the blood vessels, leading to improved blood flow. So nitro treats angina symptoms such as chest pain and pressure that occur when the heart is not getting enough blood flow. So this could be quick or long-acting, and it comes in a pill, tablet, skin ointment, or a patch form. So like we mentioned earlier, some patients may need cardiac catheterization. And if you're sent to the cath lab, surgeons will typically perform an angioplasty. And this is when a catheter is inserted in an artery in your wrist or in your groin. And that catheter is going to travel through the artery to the heart. and 2D images are taken to determine where the blockage is at in the heart. And then a balloon is inserted and inflated at the site of the clogged artery. And the balloon will push the plaque against the artery wall, and then the balloon will be removed. And sometimes in severe cases, it's necessary for a stent to be placed. And a stent is just a small metal mesh which is permanently inserted to hold the artery open at the site of that blockage. Some patients may need to have bypass surgery, and this is to replace the damaged arteries, and the surgeon will harvest a vessel from another part of the body to repair those severe damages. And next we have treatment following a heart attack. The first drug therapy is beta blockers, and this may be atenolol, bisoprolol, metoprolol, or propranolol. And they're prescribed after or during a heart attack, and beta blockers reduce the heart rate, reduce the blood pressure, and the cardiac output. So if all of these are reduced, the heart does not have to work as hard, so it's requiring less oxygen. And the side effects of those beta blockers are dizziness, fatigue, and difficulty sleeping. Another drug therapy is ACE inhibitors. And these are quinapril, captopril, benazepril, and lisinopril. And they may be prescribed to relax the blood vessels and lower the blood pressure. And again, this is going to improve the blood flow to the heart and allow the heart to pump more blood without the added stress or the added workload. And side effects of ACE inhibitors are a dry cough and headache. And the last treatment following a heart attack is statin therapy. And this could be simvastatin, atorvastatin, or something similar. And these drugs can reduce the risk of heart attacks by controlling the LDL cholesterol, which is your bad cholesterol. And statins also have the added benefit of improving the lining of the vessels, preventing platelet aggregation, and reducing inflammation, which will help to prevent blood clots. And side effects of statins include headache, difficulty sleeping, muscle aches, drowsiness, or dizziness. And that concludes our drug therapy.
So then we have cardiac rehabilitation, which includes a team of doctors, nurses, exercise specialists, physical and occupational therapists, dietitians, and psychologists. They can help to understand your condition, find ways to reduce risk, learn to cope with stress, and how to deal with fears about the future. Learning how to exercise safely, strengthen muscles, and improve stamina. An important factor in educating the patient on why the heart attack happened and what lifestyle changes they need to make to prevent a heart attack from reoccurring. Then we have some risk factors for heart attacks, such as tobacco, smoking, and long-term exposure to secondhand smoke increases the risk of a heart attack. High blood pressure, high blood cholesterol, diabetes, obesity, unhealthy diet, a lack of physical activity, age, men over 45 or older and women over 55 or older are more likely to have a heart attack than younger men and women. Stress, and then a family history of heart attacks. If your siblings, parents, or grandparents have had early heart attacks by age 55 for males and 65 for females, you may be at an increased risk. And then lifestyle changes would be to smoke or stop smoking, controlling your cholesterol, keeping diabetes under control, controlling your blood pressure, exercising, which can help you maintain a healthy weight, and then learning how to manage stress either by reducing as much as possible or practice different techniques for managing stress, such as muscle relaxation and deep breathing.
Okay, and that concludes our presentation over myocardial infarctions. Okay, we were good on time again. It was like 15:40 almost, so.
Awesome.
Nice.
Good job, guys. So now we need a quick debrief.
Yeah. So it says spend a few minutes discussing individual reactions and experience, thoughts and feelings, positive and negative synergy. I thought it went pretty well for like never getting together and working on this or like practicing until now, basically.
Yeah, I think your idea of dividing up those slides ahead of time really made it go a lot smoother.
Yeah,
I agree completely.
Mhm. I think it went pretty well.
Relate what you learned through this activity to the importance of the course in professional programs or careers in the curriculum.
I mean, like, healthcare is small groups now, and as small groups, we have to relay information back and forth to each other, and sometimes the groups have to give information to other groups. So, you know, doing something like this prepares us for that, I suppose.
Yeah.
As far as presenting things, I know that I get super, super nervous, but having kind of a team here makes me feel a little bit more confident anyway when we can kind of bounce ideas off of each other.
I agree, because I also get like super nervous and I hate talking in front of people.
Yeah.
I do too.
But I feel like we've worked like together enough times throughout the semester that it like I felt more confident doing this.
Mm-hmm.
Yeah, definitely.
Okay. Does anyone have any last things?
So should we wait until Monday to submit the PowerPoint and the paper then? You guys fine with that, just so we have some time to make changes to it and what have you?
Yeah, I said either like Sunday or Monday we could do that.
Okay.
Do you want me to submit the PowerPoint in paper, or how do we want to do that?
I don't care. I can do it if nobody else wants to.
I can do it. I just, he emailed me the other day because I submitted one and then Justin submitted one. And he emailed me and was like, make sure you guys only submit one thing per group.
Mm-hmm.
So as long as we just like find one person to do it.
Yeah.
I can do it as long as I just get the
final
copy of everything.
Okay.
And then, Laura, you can either, do you want to submit the link to this, or do you want me to submit the link when I submit everything else?
How about I'll send you the link and then you can submit it so everything's kind of together. Does that work?
Yep, that's fine.
Okay, I'll send you the link then.
Okay, sounds good. Okay, is that everything?
I think so.
All right. Okay.
All right, bye.
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 Happy Christmas.
Bye.
You too.